Mellissa Thomas here for Florida National News, coming to you from the Orange County Convention Center for an upcoming press conference that will be presented by Taiwan Excellence, which is, of course, a presentation of TAITRA, the Taiwan Trade and Economic Development Organization. Right now, this is a part of FIME 2018, which is a huge medical convention that's happening here at the Convention Center. But we'll be hearing presentations from 3 inventors with what's called medical marvels as part of the press conference. So stay tuned right here to hear more about those developments and some of the one-on-one interviews right here at FloridaNationalNews.com. Here with Dr. Antonia Novello, one of the former Surgeon General for the U.S. Thank you so much for your time. Thank you for moderating today's presentation as well. You spoke very highly of each of the different products that were being presented. Just so for our audience, kind of give an overview of each of the 3 of those and why you felt so highly of them.
Well, the thing that is very important to me is patient care, diminishing cost, and availability. And I think these 3 products that were presented today value all those 3. We have what we call the caduceus, which is a real a lens in particular that is called the smart lens, in where the surgeon is going to be able to see the intensity of the tissues of the patient, so that the surgeons can really go and operate without too many complications. And the beauty of this is that it is the doctor doesn't have to change his view nor his glasses nowhere. He's looking at the patient changing position, so it diminishes the time of operation and it diminishes the radiation in the procedure. So when looking to that, eventually there's going to be drop in cost. And so I asked the surgeon if he was going to make sure that there was a training for the utilization of glasses, so that people do not assume that the presence of those glasses make me able to do the surgery that he was talking, and he said that that will be done. I'm impressed about that. The other one, it was extremely important because if in the United States the thyroid cancer is number 4, and in Korea is number 1, and in the Middle East is number 3. It seems to me that it's important anytime that I can use a technique that is going to diminish the amount of pain in a human that has this cancer, and more, that the negative is negative and the positive is positive. With his technique as an adjuvant of the ultrasound, he will be able to do, without invasiveness, help in the diagnosis of the thyroid nodule, making sure that when he says, ma'am, your nodule is negative with a real tremendous accuracy. But what is beautiful is it will diminish the fine needle biopsy by 50%, and it will diminish the thyroidectomy by 30%. Anything that is going to do that in a human being is really, really welcome, and he has the technique. The third one is, we're having so many times in where we have patients that are in bed for whatever diagnosis, diabetes, lack of circulation, senility, you name it. He has this mattress in particular that with changes in fluctuation of the air and the temperature and the cover that is totally antibacterial, he's able to diminish the cubiti ulcers, the ulcers that people produce when they're too long in bed. And his ability to be able to do this is very, very, very good in those people who basically have no other way of moving out of that bed. But more than anything, for nurses, it will be crucial, because during the time that they have patients immobilized, they can change the dressings with a more accurate way than just moving the patient, because sometimes these mattresses are using for the severe overweight. Right. And so his ability to diminish the ulcer probability, and then when it's there to increase the cure, I think the presence of this mattress that is called Domus 3 is crucial for the patient of the future.
And one of the important things I was introduced during your very long intro that you're talking about, they mentioned that you're doing work to reconstruct, of course, your home nation of Puerto Rico.
Well,
so kind of talk about that.
I have been there for 10 months, and I have the feeling that I think that we're going to need a little bit of more press after the crisis of the hurricane, because you always tend to diminish the press when things are getting better. I think Puerto Rico is getting much better than what some of the news have portrayed, and I have the feeling that coming another hurricane, they are more ready to attack what comes down the way, with more food, more water, more generators, more everything, including 3,000 people ready from the U.S. government to help, when we did not have that in the first one. And also they have lessons learned that they did not have before, because this particular Grade 4 hurricane, they had never seen it before. So they're ready for the next one, with hopes of God this will never come while we get the grid of the electricity back into place. So having had this last hurricane, I think that the diminution in light was not as much as it was expected. So somewhere along the way, we're doing much better. So when I look into the migration that has come into the United States, Florida at least has between 50,000 and 75,000. And FEMA has been paying their rent in the places that they are. And they gave them a finality for the 30th of June, but a judge increased it until the 23rd of July. So by then, we have to find a way by which we can get the people accommodated to go back to Puerto Rico based on the reality, not on the negative news that came at the beginning of the hurricane. So I think Puerto Rico is ready for tourism, is ready to get the new hotels back in place, and is ready to get the Puerto Ricans back. And in that sense, media that says it like it is rather than the way it was is truly necessary.
All right, awesome. Thank you so much for your continued work, and we look forward to hearing more.
You will, you will.
As an engineer, what first brought you into the medical field and to want to create this solution?
First thing what you said, created it. I think in the beginning, I'm EE graduated from the EE, and I'm thinking about the technology. I'm working for the robotics, and at that time, I'm thinking if I can help more people healthy, then it will be better. So this is I'm joining a medical hospital. Then I'm joining the research team with many doctors. I would like to see how they help people. So this is the beginning, and I think at that time I have strong emotion, would like to help patients, and so I'm joined a lot of clinical trial. So I realized if I can put my experience, my technology with the medical doctor, let them do better surgery, then we can design technology that is surgeons that do surgery well. So I think that's the time I find the emotion I have. So I think I will spend all my life to do this kind of development.
We just wrapped up the presentation for the Taiwan Excellence Medical Marvels. We heard from 3 different inventors presenting revolutionary products in medical innovations. The first one was, of course, the surgical goggles, as you can see behind me. It will help provide sort of a GPS kind of imagery for surgeons to not have to look away at monitors while they're working on a patient. So the second item was, of course, to help with those diagnosing thyroid cancer. It was an improvement working together with ultrasound technology to improve the diagnosis. And the third was Apex Companies, which will help with the air mattress to reduce the amount of bed sores that patients have that are bedridden. So stay tuned right here, Florida National News, for our continuing coverage in the business realm. This is Mellissa Thomas coming to you from the Orange County Convention Center.